Okay, so my first question is, when you were my age, do you want to be a doctor?
No.
What did you inspire?
What is your age?
I'm 16.
No, I didn't decide that I wanted to go to medical school until I was in college, which I was about 18, 19 years old.
What interested you about this certain profession?
This profession?
Yeah.
Well, I didn't decide on forensic pathology until much later, until I was in my residency, actually. And I sort of just fell into it. I had decided after medical school on pathology, generally. But then when I was in my pathology training, I got acquainted with a forensic pathologist who gave presentations and seminars at our resident programs, and I became quite interested in it. So, because it was the sort of thing I enjoyed, I found out doing autopsies and relating it to finding out about crimes, and also the autopsies themselves were very interesting in many of the cases.
Were you interested in any other careers in the medical field?
Well, when I was in medical school, I considered various other items. I started out interested in general medicine, and then I decided that was not for me. And then I decided on surgery, which would have been interesting. And but then one of my mentors was a surgeon that I turned out to really dislike because of the way he treated his patients. And so I decided I didn't like surgery. And so pathology, and it's sort of, everything just worked out that I went into this career.
Can you give like a summary of your journey and how you got to where you are today?
Well, I was starting where? High school, or?
Well, yeah, go high school, I guess, and how you got interested in the medical whole thing.
Well, I was reading a novel about a doctor once when I was in high school, actually. And I guess I was graduated from high school, and I hadn't decided whether I was going to college or not. So I decided that I was going to college, and then I really got interested and decided to go to medical school. And of course, one thing then led to another from medical school, becoming interested in pathology, mainly because of the professors I had. They were quite good. And my first exposure to autopsies was under a Viennese-trained pathologist who was absolutely excellent. And he made it so interesting. And I would do a case, for instance, in which I thought was very ordinary. And he would come in after I'd done the case and sort of reviewing everything. And I'd say, oh, well, you know, it's this, this, and this. And he'd look around, but he'd say, oh, Jay, but did you see this? You know? And he just made it very interesting because he found things that were exciting about the case and made it much more interesting than I had originally assumed it to be. And so I was drawn to doing autopsies because of that.
Okay. Another question. Like, how long did you study to be a forensic pathologist?
It takes going to medical school, doing an internship, doing a specialty training in pathology, which is 4 years, and then 1 more year of specialty training in forensic pathology.
How long have you been working in this field?
Since 1968. So 78, 88, 98.
I didn't know it was that long.
40-some years.
When you knew this is what you wanted to do, did people support you, or did they try to change your mind?
Oh, no one tried to change my mind. Everyone was supportive.
Supporting you?
The field of forensic pathology is quite sparse. There are not many of us. There are fewer than 1,000 of us in the United States right now. And some of the ones who are in forensic pathology are not particularly competent. And so the field really needs good people nowadays who are interested in it, who are interested in it because of the necessity that it is to society and the good that they can do in the system.
Do you focus solely on autopsies, or are there other branches in forensics that you cover?
I do autopsies, medical legal autopsies, and I also do consultations with attorneys about other cases, and not necessarily all that are autopsies or people that are dead, but I've also examined people who have been abused children and this sort of thing.
Do you have any interesting stories that you want to share?
Oh, I have lots of stories.
Interesting stories.
I don't know whether I should share them.
Well, any specific one that you would be willing to share?
Well, there's always been, I've always been impressed that there's always many times, a sort of irony in the cases that happen. For instance, one time I had a case of a not a young man, but he was a middle-aged man, who was driving one of these trucks that like Tidy has, and the compartment on the truck, the back of it is separate from the cab, and it was during a storm, and he was going down the road, and a tree limb came off, a huge tree limb, and just squarely fell on the cab of the truck and crushed him. Well, it's just an automobile accident. I mean, it's an accident, obviously, from the storm and everything. But what made it ironic was the fact that he was driving this truck because he had left his previous profession because his father had been killed in it, and he had been felling trees. He had been cutting trees down. And so it was so ironic that a tree should kill him. It was sort of like the trees were up there saying, okay, okay, here he is, you got him. So it's there. You have to have a sort of sixth sense of humor, maybe, and we develop a forensic sense of humor in the whole thing. So if you see humor in sort of things like that, why?
That's not funny. Did you have to be relocated in order to do your job?
Oh, I've lived all over the United States. I did my training in general pathology in Texas. I moved to Virginia for my forensic training, and then I went to Oklahoma, where I was chief medical examiner for 11 plus years, and I got sort of burned out with all the bureaucracy, and then I came to California, where I was pathologist for Sonoma County for 15 years. Then I moved to Nepal, to Kathmandu, where I taught in the medical school for about 10 years, and now I'm back in Sonoma County.
If you were able to choose a different career path, would you? If you were able to choose a different career path, would you?
Well, no, I've enjoyed much what I've done. I was very happy with my choice.
And then the last question is, if somebody is interested in this field, what do you suggest for them?
Well, that they do well in school, but that they mainly have more than just an interest, because the field is vital to the rule of law. If the pathologist makes wrong decisions, the medical examiner makes wrong decisions, then the whole system breaks down. And I've seen this happen several times. In fact, I'm currently working on a case in which a pathologist made a designation of a death due to a fall, when actually the death is due to homicidal means. So it's very vital to the rule of law, and it affects many, many people, from insurance claims, their very lives, of closure as to why their relatives died. So you have a wide-ranging effect. So if someone wants to go into this, they need to be meticulous in what they do. They need to have a perfectionistic sort of attitude because they want to get things exactly right, because their decisions do affect the lives of people. And but that's what I've enjoyed doing in my life.
And I have one favor to ask you. I have a book that I forgot at home. The people I interview are supposed to sign it, but I didn't do a pen. Sign a pen. I had a pen. I just gave you my next pen, brother. Can you sign my notebook? Because I forgot my book.
It won't be very good with me standing here.
It's good.
What if I signed it up here?
Okay,
That's easy.
Thank you. That's it.